good afternoon, everyone. At Gobiquity, we are committed to enable early detection and prevention of vision impairment and providing broad access to specialized mobile diagnostic solutions. In summary, we provide brighter futures. When we look at the trends in terms of healthcare out there, there's about 400 million people by the year 2020 that will be visually impaired, and fortunately, 80% of that population will be able to be treated. But unfortunately, there's a challenge. That challenge is access to care. We're at a great shift, as Michelle alluded to, in terms of the evolution of technology and the platforms out there. In fact, those opportunities and that evolution is going to allow us to address that challenge. That is, smartphone adoption is universal with physicians. Physicians and health professionals are more accepting and willing to adopt the cloud and understand the exchange of information, and patients are more empowered and engaged in healthcare. At Gobiquity, we're part of that platform evolution. So at Gobiquity, we identified pediatric vision as the first market where we'd place our emphasis, recognizing a huge medical need, and as Gil alluded, an opportunity where early detection can eliminate and eradicate amblyopia. It's an amazing statistic when you think that 1 out of every 5 children have risk factors for amblyopia, yet only 1 out of 5 are tested. Photo screening is the technology that can be used to actually identify at an early age the risk factors for amblyopia. We at Gobiquity introduced and recognized that there was the photo screening opportunity where today less than 10% of physicians are adopting the technology. That is, pediatricians using it in their daily workflow. But there's a high demand of physicians if you can overcome 2 main barriers, which are costs and workflow. And that, plus being endorsed by major medical societies, led us to introduce Go Check Kids, the first mobile application on a smartphone that enabled the smartphone to perform a photo screen and to provide a real-time analysis of whether or not a child has risk factors for amblyopia. We did so providing the physicians with this technology and the application and helping them improve their workflow, thus ending amblyopia. We are excited about the commercial traction we've seen since the national launch earlier this year, and we've been able to see hypergrowth in terms of adoption and utilization and a strong pipeline. I'd like to cue up the video, please. In addition, we've also recognized that there's a great opportunity to accelerate our distribution by creating an iPhone application. This is a quick video that shows an overview of the application where a physician can download the application, have immediate access to their patients, and have access to our photo screening technology, which provides an immediate result. What's exciting about this is that this application has greater clinical utility, allowing physicians to use it for more patients. We've gamified the visual acuity test, allowing physicians to have access to a clinically validated protocol and be able to test the visual acuity and have a threshold visual acuity for their patients, utilizing a gamified version. So patients are going to be more excited to be involved and have their visual acuity. Once again, providing real-time results. And finally, those 2 tests are going to be complemented by having access to a vision guideline and allowing for age-based recommendations to be presented to the physicians. The net result is broader distribution, broader access, and more children being identified with great catches and being identified with visual impairment so they can be treated. We are doing a lot in terms of recognizing that we have a great foundation in terms of the pediatric vision market. We're going to expand the number of constituents that we will be servicing, including going internationally, leveraging eye care professionals, as well as empowering consumers to have access to Go Check Kids. That will open up new revenue streams related to collaboration and referrals. We also have a strategic roadmap that aligns with our mission, and we recognize opportunities where there's an unmet need in AMD and diabetic retinopathy, where people are not being identified at an early enough stage. Through our distribution channels and through our technology, we're in an early stage of development of AMD and diabetic retinopathy early screening tool that will be enabled for patients to test themselves and to be able to identify the onset of those diseases. We have a strong team with a wealth of experience in terms of mobile health, imaging software, as well as in ophthalmology, including the head of innovation, David Wong. In addition, we've had great investors, including our primary investor in Series A, Interwest, and Salesforce.com founder, Mark Benioff. We're currently in the process of raising our Series B, and we're excited to note that it's something that we're looking to take us to profitability. So in summary, at Gobiquity, we've been able to show that we can penetrate and take advantage to identify broad access and distribution for untapped markets in early identification of vision impairment. We've been able to show strong commercial traction, and then we have a team in place that's going to allow us to expand and achieve these greater goals. So in conclusion, I'd like to thank you for your time, and I ask you to pardon me. I ask you to go home and have a chance to look at this video, and this is what 2 million people have actually been watching on YouTube, recognizing that providing vision, and in this case Piper, has been given the opportunity to be see that 2 million people have viewed this and are able to see what we see, which are brighter futures. I'd like to thank you for your time.